Hello, everybody, and welcome to another episode of Mind Matters, Navigating Head Injuries and Concussions. I'm your host, Kylie Como. I'm the legal nurse consultant here with Shane Smith Law. Today, I'm speaking with Dr. Robert Bashett, the medical director and lead neurologist at the Neuroscience Specialty Centers. Dr. Bashett, it's good to be with you again today.
Kylie, it's great to be with you as well. I'm looking forward to this.
Me too. Always fun talking to you. So anybody out there who's new to Mind Matters, you got to know that our focus here is to discuss all things traumatic brain injury. So with that, I'd like to jump right in. Dr. Bashett, what have you got planned for us today?
So I thought today would be a good idea to do a quick review about concussion and then discuss why patients with concussions have brain fog, as well as why concussion patients develop sleep difficulty. And to understand why they do have brain fog and sleep difficulty, I really want to focus on something a lot of people haven't heard of. It's called adult hippocampal neurogenesis and the lymphatic system. So I want to talk about both of these because they're directly related to concussion, but they also have much bigger effects that can affect us, especially as we get older.
Sounds fascinating. Let's get down to it.
Okay, so my name is Dr. Robert Bashett, and I am the medical director at the Neuroscience Specialty Center. And we changed our name as of January 1st, 2025, from the Concussion Center. But it's the same group, and we still take care of all types of concussion. So today's talk for the Mind Matters podcast, again, it's going to be concussion and adult hippocampal neurogenesis, concussion, and the lymphatic system. So it's going to be a part one and a part two. Okay. But I'm going to start off by talking about something that you may not know. And it is, where does popcorn come from? And I promise you that when we're done with this, you'll understand why I'm starting with this. But as it turns out, the corn that we typically eat is different than the kernels that become popcorn. And only one variety of maize will actually make popcorn. It's called Zea maize everta. You're going to hear that several times. Zea maize everta. It looks like a typical corn kernel, but this particular variety is the only one that can pop and turn into a delicious snack. I started thinking about this when we took our grandchildren to the circus recently, and I told him we were going to get popcorn there. It just came to me, where does popcorn come from? So I looked it up, and it comes from something called Zea maize everta, and we're going to come back to that in just a second. So we're going to talk about adult hippocampal neurogenesis, concussion, brain fog, and depression, and what is the link between all of these? And what does this have to do with popcorn? Well, it has a lot to do with it, actually. So I want to tell you about something in February 22nd, 1980. There was a great line in this movie called Great Moments Are Born of Great Opportunities. This is the movie where the Americans beat the Soviets in the hockey game. And I remember watching that. And again, that was 45 years ago. And the reason I remember it is because of adult hippocampal neurogenesis. So before we get to adult hippocampal neurogenesis, I know everybody's on their seat waiting to hear about what that is, but we're going to talk real briefly about concussion. So this is the consensus statement from the Concussion and Sport Group. This is the international conference that was done October 22. And this is really what I think the best definition of concussion, but it is a traumatic brain injury caused by a direct blow to the head, neck, or body. Very important, head, neck, or body. It doesn't always have to be just the head. It results in an impulsive force being transmitted to the brain. It initiates a neurotransmitter and metabolic cascade with possible axonal injury, blood flow change, and inflammation. And we're going to be talking a lot about inflammation in just a few minutes. And the axonal injury, blood flow change, and inflammation affect the brain. Symptoms and signs may present immediately, evolve over minutes to hours, commonly resolve within days, but can be prolonged. So this metabolic cascade, there is a sudden neuronal firing or depolarization or excitation, and this lasts for seconds to minutes, and this is followed by neuronal depression. So the neurons are super excited, and this just lasts for seconds to minutes, and then they're basically, there's depression. They don't work nearly as well, and that lasts for several weeks. And when somebody sees stars or loses consciousness, they stumble, they look dumbfounded. This is the sudden neuronal firing, the electrical chaos. And again, it's followed by spreading depression. And when you get this electrical chaos, this spreading depression, you also get an energy crisis. And there's a 20% drop in energy production in the brain, and it takes 3 to 6 weeks to recover. And this is a very significant point of contention when people talk about concussion protocol being 7 days. No, concussion protocol really needs to be 3 to 6 weeks. You get a collapse of the neuronal microstructure. So there's shearing or damage to the axons. Axons are like little spaghetti, little thin spaghetti, and they can be twisted and sheared. There's neuroinflammation, which you're going to hear more and more about, disruption of the blood-brain barrier, and all of this is invisible. CAT scans and MRIs are negative for concussion. So again, excitation is due to glutamate, depression is due to excess calcium, mitochondria are damaged, there's a 20% drop in ATP production. This is the energy molecule of the cell, and it takes these mitochondria 3 to 6 weeks to heal. So with concussion, there are two big things that happen. One is you get dysfunction of the autonomic nervous system, and you get neuroinflammation. The autonomic nervous system is your sympathetic and parasympathetic system. Sympathetic, you may remember, is fight or flight. So you're sitting there and there's a bear in front of you and you get scared. You have to decide, are you going to try to fight or are you going to flee? That's your sympathetic nervous system. And after concussion, the sympathetic nervous system doesn't turn off. You need the sympathetic nervous system. It's really important, but it's for survival. But when it needs to be off, if you're sitting there having dinner and you're relaxing, your sympathetic nervous system needs to be off and your parasympathetic nervous system needs to be on. So with concussion, like I said, you have autonomic nervous system dysfunction. This excess sympathetic activity causes a lot of the symptoms: the headaches, the insomnia, the dizziness, the anxiety, and the cognitive difficulty. And all of this disrupts hippocampal neurogenesis. Neuroinflammation. When the brain is injured, you get inflammation in the brain. You get activation of a cell called the microglia, and that contributes to more inflammation. And then you have disruption of the cleanup crew, also known as the glymphatic dysfunction, and that's going to be the focus of the second part of the talk. But if you have this activation of the microglia, you have glymphatic dysfunction, it disrupts hippocampal neurogenesis. So what actually is hippocampal neurogenesis? Why is this so important? Well, the definition is the development of new nerve cells every day in the adult human brain. And this is a new concept. I know that when I was in medical school, everybody was taught that the brain, reaches maturity at about 25 or 26 years old, and after that, there are no more new nerve cells, and everything goes down from there. Well, that is not accurate. It actually has been known for a very long time that new nerve cells are being formed every single day in adults throughout our entire lifetime. And these neural stem cells are in the hippocampus of the human brain. And the hippocampus is deep within the temporal lobe. And you see it right there. There's a nice little picture. This right here is a picture of the hippocampus. And everybody, a lot of people know about the hippocampus because everybody knows it has something to do with Alzheimer's and memory. Well, we're going to talk a lot about that, actually. So here's another picture of the hippocampus. This is a slice of the hippocampus, and I'm not going to get into all of this, but the area that I want to focus in is this dark blue. This is called the dentate gyrus. This is part of the hippocampus, and this is where these new brain cells are being formed. Every single day, Kylie, and you and me. More you than me because you're a lot younger than I am, okay? The hippocampus is critical for learning, memory, and emotion. critical. Emotional responses are organized in the hippocampus. So when I told my grandson, when we were talking about going to the circus, I said, we're going to get popcorn. I told him that because I knew he liked popcorn. And when I told him that, he was very excited about that. That is organized in the hippocampus, recalling past experiences and imagining the future. So again, thinking about having popcorn at pleasant events, you recall that, and then you imagine, okay, I'm going to go to the circus and I'm going to get some popcorn, and you imagine that. Or you went on a great vacation in Hawaii and you're planning on going again a year or two later. That all is hippocampus. Spatial navigation. So getting home, all right, let's say I go from Claremont Road, I go 85 south to 75 north. Traffic is bad frequently when I go home. And if the traffic is really bad, I'll try to go a different direction. Well, that's because I have the space. I can do the spatial navigation. I can go 400 instead of going 85 south. I can go 85 north and get on 285 because my spatial navigation abilities are intact. And that's why people with Alzheimer's get lost all the time, because they lose that spatial navigation. Pattern recognition. So we're sitting at dinner. Kylie, let's say it's me and you, and we're having dinner, and I'm gonna try to use my spoon to eat my steak. No, that's not. I can't recognize the fork. Okay, that's a pattern recognition. To be able to tell a Phillips head from a flathead screwdriver, pattern recognition. And then encoding memories. Okay, so like when we got on here today, I recognized your voice. That your voice is in my auditory cortex. I remember that because the hippocampus helped me encode that. So there's encoding, can be auditory, it can be visual, it can be semantic. So a fact, where does popcorn come from? Zea mays everta. Now everybody's going to remember Zea mays everta. Every time you get popcorn, you're going to be thinking about this. So that is a semantic memory. And then an elaborative memory is associate pineapple with Hawaii, associate Ghirardelli chocolate with San Francisco, those type of things. So all of this is done in the hippocampus. And the dentate gyrus, again, is part of the hippocampus. This is where the stem cells are, and this is where neurogenesis occurs. And there are 700 new cells made every day in our life as an adult. We know that these cells are made in children and stuff. You think about the 5-year-old with that just absorbent brain. They remember everything you tell them. Okay, that's because they have hippocampal neurogenesis going on. So if these new cells are being formed, well, that means old cells are dying. And these new cells are primed. They're very active. And the brain is like a sponge, the absorbent mind. And these new cells, they want to learn, but they're very plastic, which means they can be molded or shaped, and that means they're vulnerable to injury. Learning and exercise stimulate the production of new cells. So the fact that I just told you about Zea mays everta, and the fact that you've heard it again for the third or fourth time, the fact that you're learning this, your hippocampal neurogenesis is occurring right now. So you guys owe me big for stimulating your hippocampus.
No doubt.
Okay. So the neurogenesis in the dentate gyrus of the hippocampus can be reduced if there's hippocampal damage. So if there's a stroke, a traumatic brain injury, neuroinflammation, if you got inflammation going on in your brain, you're not making these new nerve cells. Aging, and that's why I said, since I'm older than you, Kylie, you're going to be making more and better nerve cells than I am. We've all heard of chemotherapy, chemo brain. Well, brain fog from that. Well, that's because the chemotherapy damages these new nerve cells. And that's why these people with chemotherapy complain of brain fog. These new neurons are needed for learning and memory, but now we have an injury. This results in damage to the hippocampus, resulting in injury and possible death of these new neurons. So depending on how much damage is done to the hippocampus and the time necessary for the injured neurons to recover, and some may not recover, it can result in difficulty with learning, memory, and emotion. And how many people have you seen with a concussion who complain of trouble learning, trouble with memory, and trouble with emotion? And I think that's what brain fog is. These people with concussion, when they get brain fog, I think the concussion has resulted in an injury to these neurons, and the adult hippocampal neurogenesis for this time period. And again, it could be a few days, it could be a few weeks, it could be a few months. It's different in everybody, but I think this is why these people get brain fog. And this is also why I think they get depression. So there is a neurogenesis hypothesis for depression. And this theory proposes that impaired neurogenesis in the hippocampus is a key factor in the development of depression, as the new neurons are important for plasticity and adaptation to stress. Adaptation is really, really important. I always ask this question to a lot of people. I say, what's more important for the survival of a species? Is it how strong they are or how smart they are? Well, the answer to the question is a trick question, obviously. The answer is neither, but it's their ability to adapt. You may be very strong, but if you can't adapt, you're going to lose. You may be very smart, but if you can't adapt, you're going to lose as well. So what processes increase or decrease hippocampal neurogenesis? Well, isn't this interesting? Antidepressants improve neurogenesis. So is this why they help with depression? Now, I don't know the answer. I think it has a lot to do with that, but it's just a really interesting thought. Don't forget that learning and exercise promote neurogenesis. Very, very important. Excess stress results in increased cortisol levels, which inhibit hippocampal neurogenesis. So for a neural stem cell to begin to proliferate and differentiate, it requires glutamate. Remember we talked about glutamate before? When there's a concussion, there's this massive release of glutamate. Well, it's way too much glutamate. But for a neural stem cell to begin to proliferate, you do need some glutamate, but not as much as when you have a concussion. So immediately after a traumatic brain injury, there's a massive release of glutamate, again, which causes a massive entrance of calcium into the neuron, and it causes dysfunction of the mitochondria. And then neuroinflammation occurs after the trauma. So these neural stem cells are damaged by this excess glutamate, this excess calcium, and the onset of neuroinflammation. And the degree of injury to the neural stem cells is going to be determined by their vulnerability. And there are a lot of factors that affect them, such as B12 deficiency, vitamin D deficiency, omega-3 deficiency, stress, cortisol, how much glutamate was released, and how much mitochondria dysfunction is there. And this is one of the main reasons why I do what's called concussion blood work. In concussion blood work, which, there's no such term as that. I made that up, by the way. When we check people who have persistent symptoms, we check their B12, we check their vitamin D, we check their omega-3, among other things. So are the complaints of brain fog and depression after a concussion due to disrupted hippocampal neurogenesis? I think the answer is yes. And this is why, these people who come to your office and they have these complaints, I think this is what's going on. How do you improve neurogenesis? So what do we do to help people get better? Okay. Well, an enriched environment. So what does that mean? Well, travel to a new place, hike a different path, learning a new, do some, painting, some music, hobby, a new book, anything like that. Anything like that stimulates the hippocampus, the neurogenesis in the hippocampus. Going to a new restaurant, getting and having new food. I'll give you two little stories here. About 4 months ago, I'm in charge of dinner on Saturdays, and what that means is I order. Okay, you don't want me cooking anything. Take my word for it. And a lot of times I don't even order. I get my son to order it. Okay, but I'm in charge. Okay, and so I decided to get food from a Brazilian restaurant, and we ordered it, and I didn't like it. Okay, so but it stimulated hippocampal neurogenesis because here's why. Okay, I'm not going to order from there again. Okay, I learned something new. All right, so it doesn't have to be good; it can be bad. Okay, you do something and you get hurt or you didn't like it. Well, you know you're not going to do that again. So another silly example is about 10 years ago, I came back from, we had a great trip to Australia, and that trip is like 14 hours. And on the way back, I watched 3 movies, and they were the dumbest movies I've ever seen in my entire life. The reason I bring it up is I still remember that. And I always get reminded if I go, like my son lives out in California, if we take that long flight out there, usually 1 or 2 of those movies are still on the list, okay, that you can watch. And I just look at it and say, I'm not watching that idiot movie again.
Not today.
Okay, again, but again, the 45 years ago, I remember sitting in my little house in Augusta when I was in Medical College of Georgia, watching the Olympic hockey game. Okay, it was incredible. I still remember it 45 years later because of my brain, because it was such an impact. So things you can do to improve neurogenesis. Aerobic exercise is key. Think BCTT, which stands for the Buffalo Concussion Treadmill Test. The Buffalo Concussion Treadmill Test is what we do in most of our patients to help correct autonomic nervous system dysfunction in people with concussion. So you improve neurogenesis with aerobic exercise, a healthy diet. Like I said, art, music, painting, a new song, learning a new instrument. So social interactions, just getting out and being with people. Good sleep. Again, this is part 2. The glymphatic system is critical. Intermittent fasting, caloric restriction, blueberries. When I finish dinner in the evening, I get blueberries for dessert. Omega-3 fatty acids. I take my omega-3s twice a day. Curcumin. Crunchy foods. I don't know why the crunchy foods. I think it has something to do with mastication. I'm not sure how that works. And then B vitamins. So these are things you can do to improve adult hippocampal neurogenesis. Well, what about stress? Stress, we already talked a little bit about. It negatively affects hippocampal neurogenesis. And as a child, okay, now again, the child, the dentate gyrus of the hippocampus is cranking out these new nerve cells. But if you have an adverse childhood event, it can have serious long-term consequences. So what am I talking about? Physical, sexual, emotional abuse, neglect, domestic violence in the home, a parent is incarcerated, substance abuse in the home, a divorce or parental separation. All of these things, the stress associated with that in a child, an adolescent, a teenager, all of these things can interfere with a hippocampal neurogenesis. So again, what are some other issues? Well, for negative neurogenesis, well, stress, we just talked about that. Yep. Aging, okay, I've mentioned that a couple of times because I'm older than you, Kylie. But aging, neurodegenerative disorders, so Alzheimer's, Parkinson's, frontotemporal dementia, Lewy body dementia, all of these things, these neurodegenerative disorders, the dentate gyrus or the hippocampus, those cells are not formed as much as we get older. So what you have to do is when you're younger, you need to start doing things so that when you do get older, you have much less of a decline. So if you have an inflammatory disorder, if you have chemotherapy, if you're eating a high saturated fat diet, high sugar diet, alcohol's a big one. What do you think happens when somebody gets so intoxicated they pass out and don't remember what happened the night before? You damage the hippocampal neurogenesis. Soft food, vitamin deficiencies. Again, think about poor sleep. Think about the glymphatic system. If you stayed up all night, you feel like you've had a concussion. So patients with Alzheimer's, Parkinson's, epilepsy, and stroke often have brain fog, and this is likely due to abnormal hippocampal neurogenesis. And what do these people also have? They have sleep disruption. So if there's only one thing that you remember from this, remember that popcorn comes from Zea mays averta, and you are now actively promoting adult hippocampal neurogenesis. And doing this may reduce the development of neurodegenerative disorders. So can you prevent, delay, or reduce the severity of neurodegenerative diseases by promoting hippocampal neurogenesis with a healthy diet, aerobic exercise, an enriched environment, good omega-3, a good vitamin D, and good B12 levels? I think the answer is yes. So think about yourself, your children, your family, and this is just what I recommend. I think you should talk to your primary care doctor. You should be getting an omega-6 to omega-3 ratio, a vitamin D level, a B12 level as part of routine blood work once or twice a year. And, I don't just talk the talk, I walk the walk. So I take my omega-3, I take my vitamin D, I take my B12. I have two beautiful grandchildren that are 4 and 6. And, when they graduate high school, when they graduate college or get married or whatever, I want to be able to walk and talk and communicate and be part of that. I don't want to be in a wheelchair and not knowing what's going on. So that's what I do. And I would encourage everybody to, in addition to your routine blood work, I would get the omega-3, vitamin D, and B12 levels as well. So that's the end of part 1.
Well, Dr. Bashik, I mean, when you get into the lymphatic system, and I especially love when you kind of there at the end, when you start talking about preventative measures, things that you can do to almost preload and prepare yourself for not just old age, but should you be the unfortunate victim of, say, a concussion, I'm sure your healing and recovery is probably got a better prognosis overall if you've been doing those things, as you just listed, the good nutrition, the exercise, those sorts of things. Would that be correct?
Absolutely, that would be correct. We've always heard all of our life, having a healthy diet, doing something new and different is good, and exercise is good for you. But really, why? And I think not only does it help you from a from a heart standpoint, from a lung standpoint, but clearly, I think this is why it helps your brain.
Yeah, absolutely. And I love that you touched on that phenomenon of brain fog. People, I'm sure, have heard that term, but, wonder what that is. So I think you're kind of packaging all of this inside of brain fog. It should be extremely helpful to a lot of our audience out there. We have a lot of listeners that have, that they may be going through some of these very things or have a loved one, and they're trying to learn about that so they can help. So I definitely appreciate that. So it makes me want to know, though, more about how do you as a practitioner test for those sorts of things? What types of tests do you use to evaluate memory or these kind of deeper, more complex cognitive dysfunctions?
So we do several memory tests at our office. We do a Krayos cognitive test. That's just a general cognitive test. We do something called a DCAT, which is the Drive-Able Cognitive Assessment Tool. So we'll get somebody who, having cognitive issues, should I drive? And that's what that is for. We do a TOM test as well, another cognitive test, and then we do something called Concussion, and that requires you wear a little cap and you hear these different sounds. But those are the 4 main cognitive tests that we do in our office, and all of these can be are done and then can be reassessed after 3 to 6 months to see if there is improvement.
Yeah, allows you, I'm sure, to collect data and have that data-driven scientific backing to show, like you said, progress, where they may have strengths and weaknesses, which again would allow you as the provider to drill down on those areas, I would imagine, using the battery of testing.
Correct.
Yeah, that's awesome. You mentioned in there blood testing. We have at the firm here, we obviously, as a personal injury firm, we do get a lot of clients that have been the victim of a car accident or a workplace injury and have head injuries. And we have had a lot of them start to see blood testing as part of their diagnostic treatment. Can you talk more about the blood testing that can be performed?
Yeah, so typically what we do is I do omega-6, omega-3 ratio, which gives me the omega-3 level. I do a B12. We do a vitamin D. Those are the main three, and they're frequently abnormal and are major contributors to persistent symptoms. But we also check iron, ferritin. We do thyroid testing, do homocysteine testing, and there's some other things that we may do, RBC magnesium, but those are the main things we do, and they really have provided a lot of useful information, help us manage these people whose symptoms um, are persisting, especially for more than a month. And
That's
again,
amazing.
once we get those, we'll replace the vitamin D, we'll replace the B12, we'll start the omega-3, and then we recheck it again 2 or 3 months later. And then once they're done with us, I usually say you need to keep doing this through your primary care doctor every 6 to 12 months.
Yeah, absolutely. And then hippocampal neurogenesis kicks in, and they can remember to do that 6 to 12 months later. So isn't that right?
Exactly.
See, we got you. It's working over here. All right. Well, everybody, that's going to wrap it for another episode of Mind Matters, Navigating Head Injuries and Concussions. Once again, I'd like to thank today's guest, Dr. Robert Bashik, for joining us today and sharing his knowledge and expertise with us. You can find Dr. Bashik and his team at the Neuroscience Specialty Centers in the greater Atlanta area or via their website for more information on their services. I hope that our audience has enjoyed the enlightening and thought-provoking discussion as much as I have and is walking away with a deeper understanding and appreciation of hippocampal neurogenesis and other complex processes of the brain. Please don't forget to hit that like button, and if you would, please subscribe to our channel to keep up with our latest and greatest content. Leave us a comment and let us know what you thought of today's discussion. And as always, remember, if you're in pain, call Shane at 980-999-9999. See you next time.
In pain, so I call Shane. 980-999-9999. In pain, call Shane.